Well, good afternoon, everyone, and thank you again for joining the Superior Health Quality Alliance Roundtable conversation. My name is Kim Heft, and I am joined by my colleagues, Elena Baer, Kelsey Ostergren, Jerry Hineker, and our guest Superior Health speaker, Yvonne Burston. For those of you that have been joining these meetings since January, we of course welcome you back here every week. If you are new to the call, I'm glad you're here and I hope you stay with us too. We host this session each week, which consists of a 30-minute educational session where we highlight important topics related to COVID-19 vaccinations, boosters, and other nursing home topics and hotspots. There's going to be a survey at the end of the session, which we'd ask you to take a few minutes to complete. And then Jerry's going to put the link for the PowerPoint presentation in chat momentarily. Please use that chat box to share any questions, comments, anything that pops into your mind during the presentation. And then we'll use that for discussion in the Q&A portion of this event. Now, today's speaker, Yvonne Burston, she's a Superior Health Quality Improvement Advisor, and she's going to be taking us on a journey with a nursing home that struggled with challenges brought on by the COVID-19 pandemic. And we're going to learn how together this nursing home and her developed a plan to address these challenges. So thank you for being here, Yvonne. The floor is yours.
All right. Hello, everyone. Again, my name is Dr. Yvonne Burston. And just to give you a little background about myself, I am a registered nurse and have been for over 20 years. I've worked primarily in long-term care in the positions ranging from floor nurse to nurse consultant. Currently, I work for Superior Health Alliance, and I've been a QIA for a little over 2 years. Next slide. And so today our objectives will be to describe the challenges of one nursing home, what they faced during the COVID-19 pandemic, to outline the steps our team took to address the challenges, and to explain the results and lessons learned. Next slide. So this facility is a facility that's based in Detroit. It has 99 certified beds, and they have worked closely with Doctors Without Borders. So just to give you a little background on Doctors Without Borders, they are an international first responder. When COVID-19 first emerged as a global health threat in the early 2020, Doctors Without Borders were tasked to care for people affected by the virus. In the USA and specifically Michigan, they noted that African Americans made up 14% of the population and presented 1/3 of positive cases and 40% of deaths. Racial health disparities in access to health care and health outcomes have been exacerbated by COVID-19. This facility had an outbreak and fit the criteria for their work. This particular nursing home has a unique resident population. They have a large African American population of people without housing. Superior Health started working with this facility due to their COVID outbreak in September 2020. Next slide. Again, Superior Health began working with them in September 2020 when we were notified of their COVID-19 outbreak. Our QIA contacted them to perform a gap analysis of their infection control and prevention program and identify some areas of opportunity, including environmental cleaning, disinfection, and safe injection and PLC testing compliance. The QIA consisted in identifying compliance audit tools and education that would ensure the proper steps and protocols were being followed and IPC practices. This nursing home was also offered a free on-site IPC assessment with Superior Health Consultant. The visit was scheduled and performed on November 4th of 2020. The administrator expressed such a positive experience that she asked if our consultant could visit one of their other facilities. Over the next year, Superior Health Consultant made additional visits to assist them in making progress in their infection prevention and control practices. There was communication between visits, and the report between Superior Health and its consultant helped them build confidence in their ability to make continuous and sustained improvement. Next slide, please. But then there was another challenge. This facility was referred again to Superior Health in July for low staff vaccination rates of 16.9. However, they had an above average resident vaccination rate of 63.4. We wanted to hear directly from this facility. In a conversation with our QIA, they stated that their staff hesitancy was due partially to religious concerns. Some believe that the vaccine was the mark of the beast. The younger women were concerned about fertility, and many were worried that they were, because this is an African-American primarily facility, that they were an experiment, such as what was being done to the African Americans in the Tuskegee Airmen. We knew that this facility would be able to assist us in learning more about their efforts to combat myths and hesitancies. We asked their leadership team, would they present on this topic to describe their personal vaccination stories and what they were doing despite their staff hesitancy to boost their vaccines. Next slide, please. We work with this facility by sharing resources with them and encourage motivational interviewing. We work closely with them to identify the root causes for concern and shared strategies for vaccination readiness. Next slide, please. The nursing home also owns a pharmacy. So in owning a pharmacy, they were able to test their residents and their staff in a timely manner. And so this also helped. As soon as they knew that someone was willing to take the vaccine, they were able to get them vaccinated before they changed their mind. They were having vaccine clinics every week, if not more, and they were able to have free COVID-19 test kits. And those were made available to the residents, the staff, and their families. And this became even more of a benefit for this staff. Next slide. So because of all of this, there were encouraging results. In January of 2020, we noted gradual increase in primary series vaccination rates for staff and residents, with a relative improvement rate of 15.6 and 30.7 respectively. Next slide. But then there was another challenge. By this time, however, when we see the referral, we had a working relationship with this facility. We were able to contact the facility, talk to them about the issues, and let them know that they were flagging at 0%. After talking to them, it was noted that they had recently had a turnover in their IPC position, and no one at this time was putting the data in NHSN. Next slide. So we were able to work with the nursing home administrator and help them get enrolled and NHSN for subsequent reporting. We also encourage them to place signage in high traffic areas so that the staff can see things about the vaccines and see how important it was. Additionally, we encourage them to have their medical director have one-on-one conversations with those who were still hesitant and see if they were able to talk to them about some of their issues. We also continue to have them use the motivational interviewing. Next slide. And so there was a great payoff. Once the management had NHSN access, the team worked to enter data and to encourage their staff and residents to get boosted. By March 6th of 2020, they were at 100% of eligible residents boosted. And so at the time, the number of residents who were fully vaccinated were also able to get boosted, and this brought them up to 100%. Next slide. And so they're now at the maintenance stage, which means that they are continuing to have turnover. Just recently, their nursing home administrator, who we worked so closely with, has left the facility, but their new staff members were encouraged to reach out to Superior Health with any issues. We also continue to monitor data and reach out when reporting errors appear, such as a month or so ago, we noticed that their numbers didn't appear right for their staff boosters. We contacted the new administrator and talked to them about it and were able to find the error, and they were able to fix that. A little over a week ago, we received another call from the administrator, so the relationship is still there. They know that they can trust us, and we're here to help them. In July of 2022, we noticed that there was a drastic change in some of their rates. So that's what I'm saying about us reaching out to them and making sure that things are right and they know and appreciate that we're looking out for them and able to work with them, even though they've had another turnover in their staff. Next slide, please. We credit the nursing home's person-centered approach as key to rebuilding trust and creating lasting, sustainable change. Our team formed close bonds with nursing home staff and leadership who were deeply engaged in the work of improving their vaccination and booster rates. The nursing home found our technical assistance, educational resources, and support combined with one-on-one conversations with key medical staff and leadership, a helpful and effective method to reach frontline staff, residents, and family. This support also helped the nursing home build trusting relationships that led to increasing acceptance of the vaccine. Next slide. And so we equate the success to having an open door policy. This particular facility knew that they can call us at any time, or they can send us emails about vaccinations or any topic that they felt that they needed assistance with. We do the research if needed. So if we're able to get the resources, we'll get the resources. If we can't find them, they know we will create them. We are working with them. We're here to support you. We're not punitive in any way. We're here to offer you guidance and support. And this facility learned that and was able to use us in a positive way and ended up with a very positive outcome. And we were able to within connect the dots because a lot of facilities hear from Superior Health for different things, such as our targeted response, QII, or we may be contacting you about boosters. And so we'll talk to one another and let each other know what's happening with that, and also get a soft handoff to the nursing home to let them know you're going to be hearing from a different QIA on a different issue, but we're working as a team to support you. Next slide. And these are some of the resources that we used when working with that particular facility. Next slide. And that's it. Any questions?
Thanks, Yvonne, for your presentation. Something I had noted on slide connecting the dots, that we assist in several areas. So I actually, this just had come up not too long ago. Just don't be surprised, participants out there, that you might possibly be getting calls from different Superior Health people. There's a group working on emergency preparedness plans where we're reaching out and reviewing your emergency preparedness plans. We do that for you, and do a gap analysis to figure out what you could possibly be, what you could be missing, and work with you in that area. The targeted response QII, this is what we're looking at is when you have an outbreak, a COVID outbreak, our team will go through your infection control program, and again, figure out a plan of action too for you in regards to seeing if there's any holes in your processes or in your plan, and help you out that way. And then of course, maybe some of you have already heard from us in regards to the vaccination work and improving the COVID vaccination numbers, whether it's primary or booster. So I just wanted to put that in there for a little extra explanation.
And can I just also add, whenever a facility refers rights to us, we're able to go in and actually see step by step what you've done. And a lot of times we can figure out where the issue is with your reporting. So you may think that you've done everything correct, but when we're able to actually see what you've put in the system, sometimes we're able to see where you may have accidentally put in the wrong numbers.
Very good point.
And this is Kelsey. I think the one other point I would just add to what Yvonne and Kim have both shared is back to Yvonne's comment about how facilities can use the Superior Health team. And so, our whole goal is to support you, to be extra sets of hands to review policies, procedures, to work with you to mitigate or identify deficiencies, to collect data, to see, are we in fact changing the things that we're trying to change? So I would really encourage you, and this group has been fantastic and has been showing up consistently week after week. And so my hope is that this is some good exposure to the kinds of education that we provide, and just being here to answer questions and providing forums for you to network with one another. I think all of those things are really important, and would just encourage you, if you haven't explored some of our other offerings that we discussed last week, I think that's a great opportunity as well. But really just, I think, our hope is that through Yvonne's sort of case study today, just showing how this particular facility worked alongside us, and the outcomes associated with that relationship, which were very positive, coupled with the session last week that was, more of a higher level overview of all of the things that we're involved in, that really just kind of tees us up nicely for participants to have a better understanding of kind of who we are and what we do, what you can expect from us, as well as, what things we offer. So if you're struggling with something, you can ask. We might have it, we might not, but to Yvonne's point, if we don't, we're happy to build it or work with you to build it. And, I think our whole goal really here is to advance this work across our region. So whatever way, shape, or form that looks like, we are happy to help. And would just sort of reiterate that we're here to be partners. None of this is punitive. None of this is regulatory. And I would just encourage you to lean on us as extra hands, as part of your team, for things that you need more support with, or you don't have the expertise for. If your point of contact at Superior Health doesn't, I can guarantee they know who does. And so that's sort of the beauty of our network.
Kind of just to add to that, Kelsey, thank you so much for describing all of that. Just an example, I was working with a facility and I was talking with them about vaccinations, and they wanted more specific help with infection prevention and control. So I actually connected them with a member of our Superior Health team that has more of that knowledge. And she was able to connect them with a surveyor that could come in and help them get survey ready. So provide some of that consultation service to really assist them. It's all support, no punitive actions or anything like that. We continue to help them because after they had that service, they wanted more. So if you're looking for more assistance on that front as well, we can get you connected with the teams that are available within your state that help with that. But there's also some other outside resources other than that, if you're interested in just really having any help that you can get to just get more support. You're all doing so many more things than just what's written down in your job description. So we're here to support you and give you free resources and get you assistance. So please feel free to reach out to us, even if it's not about vaccinations or immunizations, which a lot of these calls are focused on. We can connect you with the correct person on our team that is an expert in a specific topic.
Thanks. Thank you, Elena. I also wanted to mention on last week's call, we did talk about frontline forces. Those are educational modules for your frontline staff. And we have a library of modules already. And if I go back to this resource page here, frontline forces. I know it says vaccinations on here, but maybe Elena can actually, I'm not sure if this is going to take me right to vaccinations or not, but anyways, my point here is that you all seem to be very interested in our new module that did come out. It's a UTI module that interests many of you. So I just wanted to let you know that it is on our website and our Frontline Forces webpage.
And Kim, this is Tony. I would just tag on. There's actually 3 modules, and they go over like the basics of the urinary tract system, define what a urinary tract infection is. They bring in some, hand hygiene information, and then, just kind of the risks for the elderly of urinary tract infections, gets into a little bit of a reporting change of condition. And then each of the modules, the first 2 have a quiz, and then the last one has a little scenario that people can answer the questions from. So
thanks for the added details, Tony. Perfect. So do we have any questions? Anything about Yvonne's presentation that you'd like to know a little bit more about? Maybe, it like sounded like, oh, look at how did you do this? But maybe you're like, wait a minute, it couldn't have been that easy. I'm sure it wasn't, but is there any detail that maybe you'd like to know a little bit more about? Again, you can put it in chat. You can just unmute yourself. Sometimes that's just easier.
I have a quick question for everyone, just because I know this was a topic that Yvonne brought up a few different times at this nursing home experience. How many of you experience turnover in the position of the person that reports into NHSN since the beginning of the pandemic? How many of you experienced that? Because I bet there's quite a few of you. It seems like we talk to people all the time about that. Put your answers to that in the chat. or subsequent, or on the flip side, how many of you have multiple people with NHSN access, so that if you do have someone leaving your facility that is in that position, you have a backup and you're ready to go? You can feel free to put answers to either of those questions in the chat. Stacy.
Oh, Stacy, bless your heart.
No doubt. It is a tough job to do, to keep up with everything and to continuously put that information into NHSN. So kudos to you, Stacy, for keeping up with everything. And we highly suggest always kind of having a backup just in case. I mean, if there's ever an emergency that you have to go out for, and we hope that never happens, but if there is, we want to make sure that you do have that support, so that if you're dealing with something else, that the team back at your facility feels prepared to take on what you're doing. And
Yep.
Angie, that's perfect that you have 2 with NHSN access. That's definitely the gold standard there, is that we want to try to have a couple people with it, because it, like Stacy feels clearly, it feels like a lot to bear. It's a big thing to take on all by yourself. So having a couple people is a really great thing to do. Awesome, Vicki. You also have 2 additional staff with NHSN access. That's great. Perfect, Stacy. Yeah, I'm glad to hear that it's getting easier as time goes on. That is definitely a positive, because I know there's so much that you have to report in there. So I'm glad to know that it's getting easier. Stacy, do you do the event level tracking? Is that what made it easier? Or is it just kind of, you have it down to a science now? Might be typing right now. You can always feel free to unmute yourself if that's easier than typing out something. But I am glad to hear that so many of you do have a couple people with that NHSN access. And if that's something that you want to make sure that your facility has, and you just don't know where to start, please feel free to reach out to us. That's another thing we have helped many facilities with, is new user NHSN registration. Stacy said, no, just less nitpicking on the reporting. We no longer have to report every antigen test, only positives now. Good. So I'm glad that it's just getting easier as time has gone on. That's great to hear.
Well, any other thoughts out there? Do any of our other QIAs have questions that they might want to throw out there to our audience?
I don't have a question, but I did want to just mention, as Elena said, there are a lot of ways that we are able to help. And sometimes it helps just having us on an email with you. So a lot of times you may have tried to call NHSN, have tried emails with NHSN, but sometimes if you call one of us and say, I'm trying to do whatever, and we're that middle person that sends them basically the same email that you have. But once we say, I'm Yvonne Burston, the QIA with Superior Health, they need help with blah, blah, blah. A lot of times you'll get a response quicker. I don't know why, but
I don't know why either, but yeah.
I do know that helps. So keep that in mind. If you're trying to get a question answered and you're not getting a quick enough response, contact one of us and we'll be happy to help with that.
That's a great tip.
One of the questions I had for those here is just wondering if there's any resources that any of the facilities have felt that they haven't been able to get their hands on from and are still looking for.
I like that question, Kristen. Sometimes when I'm looking for things to provide to all of you, what I think would be helpful, I'm not sure, maybe I'm missing the boat. It's like, yeah, what do you need? What are we missing? What would you like to see? Actually, just yesterday, I did not have them, but I did have to ask one of my colleagues on a different team for some audit tools that a nursing home was looking for. She happened to be looking for a PPE audit, and no, just the PPE audit, but just regardless, so this is what I mean. Do you need audits? Do you need resources? Just, putting it out there.
And even if they're not specific tools, if there are concepts you're struggling with, whether it be NHSN data entry or how the heck do I, interpret these new guidelines or, whatever it is, I think, we're always interested in feedback on what it is. What are your pain points? What things are challenging you? What do you need some interpretation on? Anything that we can do to be helpful, we're happy to do so. So even if it's not a specific tool, but more of just like a concept or something that you're struggling to implement or to understand, we're happy to, respond to that. So I guess I'll pause there and see if there are any thoughts on, as Kim mentioned, those specific tools or any larger concepts that we could help in providing resources or doing additional education.
How's everybody feeling about the rules of participation? All coming out on October 24th. I know that isn't necessarily our, like what our big, I don't know, I guess our vaccination program here today, but I looked at that. I've been reading through that. Boy, that's going to be a beast to get an order. Well, if we don't have any other questions, I think we could wrap it up early today. I don't know if I have to look through here. Jerry, if you haven't put the slides in, maybe you could put it again in there if participants came in late. And otherwise, you could also, Jerry, please put in the evaluation. We'd appreciate it if you would do that for us too. Perfect. All right then. Well, everyone, I'm glad you were here. Enjoyed our conversation. And on that note, we'll give you back a half hour of your day today, and we will see you all next week, hopefully. All right. Bye, everyone.